Yes, question.
This is slightly related to this thing about corruption, but it's not corruption. It's I think the Democratic candidate for governor brought up the issue of how to reduce the costs of the legislature, and this would be both honest costs, not the corruption costs. And I wonder if you have any ideas on that.
Well, we have actually cut our costs substantially. We reduced the use of outside counsel. We've been looking at our staff. There's been a shrinkage on our staff. And generally, I think we need to look at our benefits, particularly our health care benefits and pension benefits, to bring them more directly in line with what you'd see in the private sector. I don't want to get too carried away about that. It's symbolic. It represents perhaps a few hundredths or thousands of % of the big problem of getting the budget properly in balance. But we do need to build confidence, and that would be a good place to start. But again, I want to make sure that people think carefully about what you do in the relationship to the legislature. If you reduce the effectiveness, the power, or the ability of people to run for the legislature, you're going to change the balance of power between the executive branch and the legislature. You're going to enable lobbyists and senior staff who are unelected to be in an advantageous position in relationship to your elected representatives. So yes, let's get our expenses under control, but don't weaken the legislative branch, and don't make it less professional, and don't reduce its capacity. I think you'll be sorry if you do that.
Susan, we do need to seriously look at the cost of our legislature. We have, what did they decide, 8 or 9 staffers per legislator as support staff, and some of them are paid at an astronomical rate. Some are paid barely above minimum wage. Some are in there just as patronage jobs, and those need to be eliminated. We need to really seriously look at the way our caucus is set up, and I would like to see us look at, and the chances of this are slim, but it's term limits for leadership roles. I think good legislators need to stay in, but we have this power in leadership that has been in for a very long time, that are then able to control government, that doesn't allow rank and file to get their ideas out, that doesn't allow rank and file to truly be the representatives that they need to be. It's not a popular position to hold when you're talking to other legislators, but I think it's a way to truly make the legislative branch be able to truly represent people. Bringing those costs together, looking at why are we using so many outside legal counsels that are frequently brought in on no bid contract deals. We have legal services in every area. We need to use what's in-house. If they're not good, then we need to get good people in.
One more question. There's one over here too. That's fine. Okay, one, and then we'll continue.
I'm not sure of the proper terminology, but I think you know what I mean. I'm curious as to why Pennsylvania has refused to enter into the pool and the new health insurance. The pool, as I understand it, for those who do not have insurance or cannot currently afford it, we are one of the states that has refused to undertake creating such a pool. What is the reason for that, and what can be done about it?
Susan? So we have the adult basic program that allows people to buy into insurance, but it is at a higher rate than I think it should be. I'm not sure exactly what pool what piece you're asking about, quite honestly. The federal health care piece that Tom Corbett is...
The new federal program, as I understand it, calls for the state and for the central government to have a pool that will take care of those who cannot afford private insurance. Those who cannot afford private insurance, those who don't have it, those who have never had it, because eventually everyone is required to have it. And as I understand it, at present, Pennsylvania refuses to enter into that, and it is left up to the ability to buy insurance with regular companies.
If you're talking about Tom Corbett's decision to fight the federal health care reform piece, that was pretty much a Tom Corbett decision and not one that has been supported by our governor. We do have adult basic that allows people who can, at a lower rate, to buy into some insurance in Pennsylvania, but unfortunately there's a wait list for it. And I'm not sure how that lawsuit is going to all shake out between Tom Corbett and the federal government.
Yeah, the lawsuit is whether or not there's a mandate for everyone to have insurance requirement. And if you don't, then you have to pay effectively a fine for not having insurance. There is a health exchange that was considered required by the federal government in the most recent federal legislation, which is really actually almost like a beefed up website to enable people to see what insurance opportunities there are out there. I was very upset when we passed the adult basic in the first place because it was never properly funded considering the number of people that were going to be needed. If we're going to go into the situation of providing subsidized health insurance for all of the people that do not have it, it's a very, very expensive proposition. And unfortunately, the people that take advantage of that and tend to sign up for it are more often those that are in need of health services. So there's been mistakes in the past. Massachusetts has run into this with their universal health program, that the people that are first to sign up typically have pre-existing conditions or having difficulty getting health insurance otherwise, and they use tremendous amounts of health care. And so they've grossly underestimated the cost that is going to be borne by that. We clearly need to change the system. I think that perhaps without thinking about healthcare costs, just trying to expand access without addressing the rapid increase of costs, we're going to get ourselves into a very serious jam, particularly given the tight economic times we're in. And I was disappointed that the health insurance program that the federal government passed did not really work harder on the cost side, and that's where I think we need to be spending time. But unless we work on that, the universal access is going to bankrupt us.
You speak of our setting priorities, and you repeat that, assuming that we're going to have to make some cuts somewhere. Could you hypothesize with concrete examples where we might see cuts that we could tolerate?
Yes. And what we're talking about is billions of dollars here. I mean, often in the debate I hear discussions of a few million here, a few million there, and I'm not saying those aren't important. But given the fact that these are difficult political decisions, we're going to have to really start looking at large numbers. The Auditor General, who happens to be a Democrat, has indicated that there's approximately something in excess of $1 billion of misappropriated dollars in the welfare department. Our biggest single sections of the budget are the welfare department, education, K through 12 and higher ed, the prisons, and then obviously things like debt service. The rest of the budget, the legislature, all of the other programs, parks, recreation, Department of Environmental Protection, are literally in the neighborhood of about 10 to 15% of the total budget. So we've got to go after the big numbers. Public welfare, we've got to make sure that we take the Auditor General's report and get as much of that $1 billion or more as we can right off the bat. On education, we are trying to spend our way to success in education. That's been the goal. That's been the target. I do not believe that by simply spending more on a per pupil basis that you're going to solve all the problems. We have low spending schools that have tremendously high accomplishments, and our highest spending schools are those that are doing the least well. Clearly, you need to spend more in areas where there's poverty and there's limited resources at the local level. But we have to start pushing the programs that have been proven successful in low-performing schools and support them, not just broadly throwing more money at the problem. So there's going to have to be some rigor and some focus and some economies in the school budgets. In addition to the $600 million we added at the state level in education, the federal government threw in an extra $2 billion. It's a huge amount of money that was thrown at the schools, and I don't think that we've been able to see anything like the kind of improvements because they weren't focused. They didn't direct the money correctly. So those are the two biggest areas. In correction, we've got to get away from the rapid increase in population in the prisons and focus in specifically on making sure that the prisons are used for violent, dangerous people that are going to cause problems out in the street, and that those that are nonviolent offenders that are there because of minimum mandatory sentences but are otherwise nonviolent, that we find alternative ways to punish those in a less expensive way.
No, Susan, I'm sorry. You did non-verbally. Go ahead.
We need to look at a lot of pieces, and the pension crisis that's coming along. We need to refocus the way our pensions are organized in the state. We need to move away from the defined benefit and go towards a defined contribution. We need to look at how are we going to make corrections, our prison system, more effective. There are many times where we could have people who are working in Chester County we have a wonderful mental health and drug alcohol court system that keeps people out of the prisons but allows them to learn the skills, enter rehab, and find a way to become productive members of society. We need to make that more of a statewide piece because there's only a few counties in Pennsylvania that have those court systems that divert people from the prison system. By diverting people from the prison systems, we can reduce the cost, and we can have those monies available to us. And I think the corruption. I understand. Jack Wagner is saying we've got $1 billion coming out of the Department of Public Welfare that's misappropriated, and I believe there's actually more, and there's more in other areas as well. Going after the waste of corruption. In the last 7 years, we've given that $2 billion in no-bid contracts in Pennsylvania. We can do a better job.
You have one more question.